This is Volar splint. It's immobilization of the wrist joint for restoration of motion, pain relief, joint alignment, functional support, and positioning for healing. There are the most common pathologies of the wrist that benefit from this orthosis include carpal tunnel syndrome. Positioning of the wrist varies according to the diagnosis. However, the wrist is usually maintained in either neutral or slight extension.
Purpose of intervention and related theory. The purpose. The inflammation can be subsided with putting the wrist motion in immobilization as a concept. The pressure in carpal tunnel syndrome may be increased with a position of flexion or extension. Thus, there is a need to keep wrist in a neutral position splinting. The theory, according to the Gilberman 1984 general principle of splint application, is to maintain the wrist position in a neutral position because it will pressure at the median nerve that passing through the carpal tunnel either in flexion and extension position. Besides, according to the Menenter et al. 2001, the clinical condition for orthotic splinting is to hold the client's hand in a neutral wrist position during the client is asleep, as usually their wrist will be flexed position without being able to correct by themselves. Fabrication of the splint should be at the wrist angle of the carpal tunnel splint. The rhombical shape need to be altered distally out of the carpal tunnel part in order to decrease the pressure at the median nerve. Splint kinematics and kinetics is related to biomechanical frame of reference. The purpose of this FRR is to analyze the basic principle in understanding various standard design, construction, and fitting for CTS splint. Biomechanics orthotic splint application is to possess a specific understanding in orthotic splinting function, including the clinical orthotic assessment.
Procedure making volar splint. First, draw a client's hand pattern on a paper. Draw a volar splint pattern and cut it down. Paste it on the thermoplastic splint and cut the splint accordingly to the pattern. Mold the splint inside heating pan. Boiling water of the heating pan around 60 to 70 degrees Celsius. Positioning the client's wrist about degree 30 and mold the splint. Marking of the splint to make an adjustment. Cutting off excess thermoplastic material to make an adjustment. Put padding all around the splint. Heating of the Velcro tab with a heat gun to help them adhere to the splint. And lastly, the trapeze placed 2 straps on the forearm through with one of the wrist level and 1 strap on the dorsal surface of the hand that connect the metacarpal bar and the hypothenar bar.
Splint regime for carpal tunnel syndrome can be worn on nighttime or daytime, but some studies said it recommended to wear at nighttime only. Here are some studies can support this splint regime. Safety precaution when using splint.
Avoid splint from exposed to heat. Keep splint clean and away from dirt by washing them with wet tissue or pipe water only, and do not use splint too tightly. Prevention from redness also.
These are the advantages of using splint for carpal tunnel syndrome.
It's a non-surgical treatment, help in relieving pressure on the median nerve in the carpal tunnel space, decreasing in symptoms and improving hands functions.
Hi, I'm Wani and I will talk about the evidence of intervention. Volar splint is suitable to be used as a treatment medium in most CTS cases if the angle of the wrist is in neutral position. Also, the study suggests that the wearing of splint could only be effective if only in 2 weeks of its usage. The second one is the splint with wrist immobilization, either volar or anagata. Both will be commonly useful for CTS condition. Okay, the third one is the splint is effective for its user. However, it is not recommended to be used for all CTS cases. As a result, an extra advice needs to be addressed as a protocol simultaneously in donning splint as a treatment medium.
Alright, the last one is confirm that both splints showed significant improvement in reducing pain and symptoms of CTS.